Very few of us have had the opportunity to have our professional lives and our personal lives collide in a huge way. About 4 years ago, that's exactly what happened to our next speaker. It's a pleasure to have Dr. Lara McKenzie here from Nationwide Children's Hospital. Please help me welcome her to the BRUTx stage.
About 5 years ago, my husband and I started trying to have a family. And when we got the positive news of a positive blood test, we went to see our doctor for an ultrasound. So we're in the exam room, and the doctor's looking around, and he said, "I see a baby and a heartbeat." And we looked at each other and thought, all right, we did this. And the doctor kept looking around, and he said, "I see a second baby and a heartbeat." And we looked at each other and thought, twins? We nailed this. Then he was quiet for a while, and the doctor was looking around some more, and he finally said, "I see a third baby and a heartbeat." And we said, oh shit. So we started to prepare ourselves and our home for the arrival of our triplets, and we did what many people call child-proofing or baby-proofing. My husband called it ruining all the fun, one activity at a time. And I'm an injury research scientist, and so I make recommendations about how parents should adopt known effective countermeasures for injury. So to me, it was just another day at the office. What a lot of people don't know is that injury is the leading cause of death for children in the United States. In fact, it's the leading cause of death for children ages 1 all the way up to 44 years old. Childhood injury deaths account for more deaths than the next 3 causes combined: homicide, suicide, and cancer. And about half of these injuries occur in the home. This is where little kids, spend a lot of their time. But most parents are unaware of what the hazards are, what the risks are. So what are we talking about? How bad is this problem? Well, about 9,000 children each year die from preventable injuries. Another 250,000 are hospitalized, and more than 9 million children are treated in hospital emergency departments. What types of injuries are we talking about? Well, the common causes of fatal and non-fatal unintentional injuries are things like falls, fires and burns, poisoning, suffocation. Let me give you a couple of examples. House fires are responsible for 90% of fire-related deaths. Medication is the leading cause of child poisoning. And TV tip-overs. About 13,000 kids are injured every year when a television falls on them. There are many other hazards in our homes: stoves, ovens, showers, toilets, doors, stairs, windows. These are things that everybody has in their home. So that was a lot of bad news. Let me give you the good news. We're not waiting on a cure. Diseases like cancer, we already have a solution. That's known effective countermeasures. These things are using stair gates, locks and latches, smoke alarms, carbon monoxide detectors, outlet plugs. And these things are known to reduce or prevent the consequences of an injury. But there's some barriers. These things aren't easy to do, and not everybody does them all the time. So what are some of these challenges? Well, the first is knowing what the risks are, knowing what the hazards are. So when I said child-proofing, I bet everybody in the room thought about outlet plugs, because that's the first thing that comes to mind. But do you know about button batteries? Button batteries are things that are found in remotes, toys, greeting cards. And about 2,800 kids ingest button batteries each year. That's 1 kid every 3 hours. What happens when you ingest a button battery is that it can burn you from the inside. These can be really dangerous injuries. The next challenge is finding information. So let's say you're convinced about some of the risks and you go to the internet to find information. The information for injury is not centralized. It's not usually all in one place. Some of the information is hard to follow. Some of it's not credible. And some of the recommendations can be very broad sweeping in general. Things like secure your windows and doors. I mean, what does that even mean? The next problem is what I call the big box store problem. So everybody's gone to their favorite store and you've seen this aisle. They have lots of products from floor to ceiling, safety products and baby products, and then you're overwhelmed with what to pick, What do I need? What's going to work in my home? And if you're lucky enough to run into a sales associate, let me just tell you, you probably won't get the benefit of having the safety expert provide that information. So I'll just say, keep your receipts. The next problem is what I call a time, tools, and money problem. You need to be able to afford to buy all of these products when you bring them home. You need time and persistence to install them, and you need to be a little bit handy. I mean, these things require a little bit of finesse to get working in your home, and some of these things need to be repeated over and over. The next problem, and I think this is one of the biggest challenges, is what I call the bubble wrap problem. So when we talk about things that are hard to do, that need to be repeated, and when we make parents think about their own child being injured or possibly dying, this is a really uncomfortable emotion for people. It's something they don't want to think about. And so the natural reaction is to dismiss this advice and say things like, you just want to bubble wrap kids, or we just need to let them grow up, they need to learn, or my parents never did this and I turned out okay. We call that one survivor bias, but the problem with those arguments is that they don't hold up, because we know that kids get injured. We know how they get injured, and we know where they get injured. And we can't, and we know that children are going to fail, they're going to fall, they're going to test, they're going to reach. And they can't be responsible for their own safety. We have to do that for them. So my husband and I set out on this journey to do this ourselves. We put together 3 cribs and 3 dressers and 2 swings and all this stuff. And we tried in vain to install a stair gate on our own stairs. We live in an older home with a wrought iron railing, and I can't tell you how many times I went back and forth to the store to get the right kind of gate, or to find locks and latches that are going to work in our kitchen, or to test our smoke alarm without inadvertently calling the fire department. And at the height of my frustration with this, I said, why have we, the injury professionals, made this so hard for parents? And why hasn't somebody come up with an app for this? So that's just what we did. We created the Make Safe Happen app. And it's the best thing other than having a safety expert in your home. It puts safety in users' hands. We give you room-specific checklists so that you can figure out what to do in each room of your house and specific advice to follow. We have a place where you can create a shopping list or order products directly through the app and have them sent straight to your home. Or you can take that shopping list that you've created and go to your favorite big box store and get exactly what you need. We have a place where you can schedule reminders for changing the batteries in your smoke alarm, something you should do every year, or testing your smoke alarm, something you should do every month. We have a place where you can add the poison help number to your contacts so that you have it right in your smartphone. And all of the information in the app is tailored to the ages of your children. So you can pay attention to what I need to do today for the ages of my kids, because this is a lot of stuff to do and it's hard to do. We also let you celebrate the little victories. This is a pat on the back for getting some of these tasks done, because as parents, don't we all need more of that? So when I became a parent and tried to do some of these things in my home, I realized in a significant way that it's incumbent upon researchers to make the information available all in one place and easily implementable, and above all, compelling. Nationwide, and their commitment to this cause is what made the Make Safe Happen app possible. And saving kids' lives and keeping kids safe, that's what I do, and I'm really proud to be doing that kind of work. Oops, sorry. If somebody would just now invent an app for picking up after triplets, I think I'd be all set. But the most important thing is that the Make Safe Happen app is not just for people who hear 3 heartbeats at their ultrasound. It's for everybody who cares for kids, and together we can make safe happen.